we do with the Hospital Automated Solutions Division? This is the question we're here to answer today, and it is a question with a true range of possibilities. Some of these we've had to cross off right from the start. You're not exiting the division, you're not selling it off. You're not going into gimmicky strategies which don't leverage your core competencies or fit with your strategic values. And finally, you're not just going to sit idly by or only focus on your RFGs. You're better than that, and you haven't come to where you are by sitting quietly and letting the other competition pass you by. What you need to do is three things. You need to grow, you need to expand, and you need to innovate. My name's Jack Nolan. Today I'm joined by my colleagues Rhiannon, Natasha, and Sean. Together, we represent Real Consulting, and we're here to deliver our strategy for growing, expanding, and innovating. So this sounds great, but let's take a look at what it really means. We have identified a few opportunities for you. The first of these is to grow in your existing markets. Now, we're not here to tell you how your salespeople and your lobbyists should be doing their jobs. We're here to identify where they can be doing their jobs better and where they should be focusing their efforts. So while you are doing very well in some of your current markets, there are areas for improvements and areas where you do need to focus a little bit more. The second opportunity we've identified for you is expanding into new markets. And this is where you have a lot of options. We've looked at everything from working in dentistry to going into vets. But the opportunity we've really identified as the strongest and the best fit with your organization and your division is the surgical and medical products, moving into this area. Finally, value adding to your existing product offering, innovating, investing in innovative technologies. This is a key area for McKesson Technology HAS. This is how you do so well. It's what your business is based around. You really do need to be in innovative technologies, and we've got some really exciting things that we're looking forward to showing you a little bit later on. So together, these three strategies will successfully penetrate more of the market you currently exist in. You'll be moving into a new market which fits with your current value and your product offering. And finally, you'll be positioning yourself not only as a market leader in size, but in terms of innovation and development. So before we do dive into this strategy, allow me to take you through some of the analysis we've conducted on your current business and where you operate at the moment. The first thing we had to do was really identify what HAS does and where you fit within the current market. Essentially, you're selling products which distribute pharmaceuticals within hospitals. You're doing this to reduce inefficiencies, save costs, and increase patient care. On a macro level, this ties into the holistic product offering of HAS within McKesson. You're not just a division going out on your own. The things you do need to really add value across not only the IT section, but the company as a whole. Additionally, everything you do needs to drive three key values: increasing efficiencies and reducing costs within hospital, increasing patient care, and reducing costs as a whole. So once we had this covered, we had to look, all right, where are you doing this? Where can you be doing it better? And the first step was looking at your current sales. So to sell products at the moment, hospitals will put out a request for proposal, an RFP. You will reply to this request for proposal with a tender, and if you're selected, you will sell your products. Now this sounds relatively straightforward, but there are a few key aspects to consider. First of all, if you're not hearing about an RFP till the government puts it up on a website, you're not going to get that RFP. Relationships and prior communication are key. What we really identified, though, was where these RFPs are working for you. Now, that blue square represents roughly 90% of your market penetration and where you're operating at the moment with your products. That isn't where 90% of hospitals are or where 90% of Canadians live. Your sales team are doing an extremely good job here, but what they need to focus on is moving out west and into the other provinces. The second point we had to have a look at was what kind of strategies are open to you. Now, I know this is a lot of information, so I want you to focus on a few key factors. We've looked into the veterinary market, the dentistry market, aged care and long-term care solutions, and finally, medical and surgical supplies. Now, all of these offerings have a few varying costs and factors. For starters, the entry into the market and the potential revenues. But the area we really want to focus on is the strategic fit with your McKesson HAS goals. There's no point developing a veterinary market solution because that would have to be some impressive strategy to be working with vets and somehow still fixing hospitals and healthcare within Canada. Now, any solution you do needs to relate to your core value offering and your core product offering. And that means in hospitals, reducing inefficiencies and increasing patient care. And that's why we have selected this as your expansion strategy. That's where you can move to. Finally, we've looked at innovation. You want to solve the biggest problems facing the Canadian hospitals today. Well, we looked at some of these problems, and one of them that really stood out to us was the way armbands work. When you go into a hospital at the moment in Canada, you're given a paper armband, and depending on what kind of conditions you have, you could be given a lot of paper armbands. The issue is that these are irritable, they tear easily, they're not clear, and they're not linked up to anything electronic. There was one tragic case a couple of years ago where a patient who was signalled as having an allergy was mistaken for having an armband which meant do not resuscitate. These type of problems should not be happening in 2015, and we've developed a strategy for moving on to electronic armbands. This ties in with automation, it will reduce inefficiencies, it will reduce human errors, and most importantly, it will provide real value to patients in Canadian hospitals. So these are our points of analysis. Let's take a look at exactly how you can grow, how you can expand, and how you can innovate.
So what's our current market for HAS? We're in roughly 250 hospitals, but with 550 still remaining, and a market and a strong volatility surrounding our revenues, we need to look to how we can capture market share. Focus on our RFP process to capture this market share. But before we can focus on the process, we need to know who our efforts need to be targeted towards. If we look at Canada from a provincial level, we can see that there's a few standout provinces. This is based on population, the number of hospitals, and the percentage that those provinces are allocating towards healthcare. Of this, we can rule out Quebec. We have a strong presence there, and that's not our focus point. But what is our focus point is Ontario, Alberta, and British Columbia. This is where our efforts need to be targeted towards. We can further segment our market down, and we can look at really where the scale and scope of potential HAS offerings. This data is excellent. It gives us that broad level view across the 3 provinces. But to be effective, we need to show you the market you could be capturing right now with HAS solutions. It's estimated that 48% of Canadian hospitals are operating on an out-of-date technology infrastructure system. This is technology that no longer efficiently and effectively services the market. With this statistic, the number is 197. 197 is your right now market for HAS that is ready to be captured. It is also 197 potential RFPs for McKesson to secure. But how do we ensure we do this? How do we communicate our value? Now, we know that when we take our value to the client, we see results. Our core competencies, our quality, reliability, and impeccable value offering. So we need to start proactively and tactically communicating this to the market, going to the market first. Let's look at the case study from Niagara Health Systems. We know that when they solicited McKesson to look at their hospital, they said, what can we be doing to improve your solutions? We went to them, we gave them an overview, we showed them the benefits of McKesson products across these 4 segments, and we showed them the strategic fit of HAS in their business. We communicated our value offering and showed them the need for our services. The deliverables were $2.73 million in products sold, as well as the company saw a return on investment in 3 years. In this situation, Niagara solicited us. Imagine what we could be capturing if we took the approach to solicit them. We went to the market first to communicate our value. Now, what would this look like on a tactical level? We need to identify the hospitals, identify the segments that we need to be targeting. Who's using out-of-date technology? What hospitals are being poorly ranked consistently or seeing a high number of adverse outcomes? Then, we need to conduct the primary analysis. Draft up the CBA. Where do we see McKesson fitting with their business? What do we have to offer? From there, this is where we start generating interest. We make the call, we get the interview, and we communicate our value. Start pushing our products from top-level management. From here, we know that when it comes time for that RFP to be released, the company are looking to nowhere else than McKesson. We've built a relationship, we've educated them on our products, we've showed the strategic fit within their company, and we've showed them the CBA, the cost benefits of our products within their service line. Where can it improve their business? when that RFP is released publicly, they're not looking to anyone else than McKesson. This is how we at all phases communicate our HAS reliability, quality and value to sell it to customers and secure the maximum number of RFPs. This is how we grow. We grow our current market share and we grow double digit. Now, let's expand.
Earlier, we identified that the best market for HAS to expand into is the surgical and medical supplies management systems. So what exactly do these systems do? They're very similar to the current product offering that HAS has, but instead of looking to the automation of pharmaceutical supply, dispensing and packaging, we're looking at surgical and medical supplies, from things like bandages through to pacemakers. These products have simple touchscreen interfaces that allow nurses to scan a barcode, receive their item, and then links to the system which automatically monitors inventory levels and patient charges. We're going to be offering these products to hospitals. This is the industry that you know best and that you are passionate about. This means that you can really leverage your core competencies in quality, service, and industry knowledge in order to give hospitals what they're really looking for in this segment, which is reliable, easy to use, and accountable access to supplies. This means that the ease of entry into this market is extremely high, making this the perfect platform for HAS to expand. When we look at the competitive landscape, we can see that only 2 of McKesson's key competitors are even offering this service. Further, when we look a little deeper, we can see that McKesson offers some key advantages over the competitors. You are the market leader. In every one of your current product offerings, you beat your competitors on factors such as service, quality, design, and integration. By replicating this and coupling it with your established relationships in hospitals, you are well placed to capture this market. So how are we going to enter this market? We're looking to leverage your existing relationships. For a supplier, that's JV Medi, who you have a good working relationship with. For customers, we're firstly looking to the hospitals that you're currently servicing. These hospitals have seen the tangible benefit that your automated solutions can provide for them, and we can offer them the ability to integrate this new product with their existing systems. Further, we'll be looking to incorporate this expanded product into the active RFP approach that Rhiannon just talked about, really focusing on educating hospitals on how this product can offer them some core benefits. So what are these core benefits? We see HAS as offering hospitals 3 outcomes: reducing costs, increasing efficiency, and increasing patient safety. If we look to a case study in which a clinic in the US installed these systems, they saw massive changes. They saw increased patient charge capture, labour hours saved, and huge reductions in inventory wastage. Further, the nurses really thought that this system was helping patient safety. In a high-paced hospital environment, having what you need and knowing it's going to be there is crucial. Overall, expanding into this market is going to achieve some key outcomes for HAS. It's going to give us increased revenue, and it's going to give us an increased portfolio of healthcare solutions, allowing HAS to expand from being seen as simply a pharmaceuticals automator to more of a holistic solutions provider for hospitals.
Investing in innovation and technology. One of your key competitors stated that they wanted to be the Google of healthcare. Well, McKesson is bigger than Google. You are to healthcare what Apple is to personal devices. And with that in mind, we just have one more thing to show you. Currently, there are huge tech innovations within the healthcare industry. However, we've identified 3 that are having massive impacts. Digitally integrated armbands that are actually saving lives. Secondly, the Uberification of the pharmaceutical industry to deliver drugs to the patient's home. And thirdly, an end-to-end solution that monitors a patient at their home for their vital signs and their drug dosage. However, not all 3 meet your key strategic objectives of reducing costs, increasing efficiencies, and more importantly, saving lives. Now, your CIO stated that McKesson ideally can scan bracelets within hospitals to confirm their drug dosage, what the drug is, and to ensure that everything turns green when it's the right drug. There's maybe one hospital out of 1,300 in Canada that is doing this right now. A cost-effective alternative is soft material-based armbands. So this can be integrated into existing digital solutions within the hospital and is a nice middle ground between the expensive, capitally intensive electronic bracelets and the current paper-based bracelets that Jack talked about earlier. Positive Patient is the child company of MediRx. They are currently distributing these armbands throughout Canada. They've had an extremely positive response, and they are known to be open to a bigger company like McKesson coming in to distribute these throughout every hospital in Canada, as they are only currently in 4. These bands will link in with existing IT software as well as McKesson's Relay Health systems. So your HAS systems have 2 key objectives: automation and patient safety. This will be replicated throughout the armbands. They further reduce medication errors, they link with your existing Relay Health systems, and thirdly, they increase efficiency and reduce costs in the long term. Looking at the total value creation of the Grow, Expand and Innovate strategy, they will achieve double-digit growth within EBIT and grow targets within 2017 and 2020 respectively. On your left is the EBIT forecast, and on the right, a sensitivity analysis which takes into account 1,000 individual NPV scenarios for each strategy. So this gives us a broad range due to the uncertain parameters to ensure your targets are met of the double-digit growth within a worst case, base case, and best case scenario. The key takeaway from this is that all 3 strategies combined give you a total value creation of 8.6 million Canadian dollars within 5 years' time. Our key theme with our implementation is the immediate rollout of Grow, Expand and Innovate with a continuous assessment throughout. So growing, actively seeking these RFP opportunities, expanding, ensuring you lock in that first supplier, and innovating, importantly setting up that contract with MediRx for effective distribution of their armbands throughout Canada. So ensure these are effectively rolled out immediately, and also continuous assessment to monitor the effective distribution of these new products within the McKesson product range.
What we've done today is told you how to grow, how to expand, and how to innovate. This has 3 key factors. Firstly, we've identified where in your current markets you're not growing enough and you're not reaching your full potential. This is where you need to start targeting your sales and your lobbying efforts. We're not here to tell your divisions how to do their jobs. We're here to focus them and make sure that the work they're doing has the best outcome for McKesson. We've identified the best hospitals in Canada that you can be doing this, and we've identified these from small, medium to large, going right down to the amount of machines you would be selling to each hospital and what you need to communicate in a cost-benefit analysis when you go to each hospital. The big outcome of this growth is successful market penetration. But once again, this ties in holistically across the McKesson brand. You're not just selling more products to hospitals, you're getting a foothold in these hospitals to sell more of your IT solutions and more of your overall solutions. There was an example last year where after just having the foothold of the HAS within a hospital, you went on to secure another RFP for more of your products. This really is driven by this value. We're pushing out into more hospitals, not just selling more products in the hospitals where we currently exist. This is growth. The second part of our strategy is expansion. We've gone into a new market, but it's not some cheap gimmick and it's not outside of the scope of your organization. It really closely relates. It's surgical and medical. There'll be very similar devices, but will contribute to the holistic ecosystem of your products, and most importantly, it will increase the care you can give to patients, reduce inefficiencies, and save costs. Finally, innovation. McKesson has existed for almost 200 years. You haven't existed for 200 years by sitting back and doing whatever the rest of the market does. This is really that something more. It's moving into an innovative new area, becoming a market leader in an area that ties in with your automation, reducing inefficiencies, and saving more costs. Together, this will successfully penetrate your market. You will go into a new market to increase your revenues and your product offering, and you will position yourself as a leader in innovation and development, not just in terms of market size. We're Real Consulting, and we thank you for your time. We'd be happy to take any questions you have now.
surgical supply solution that you presented, you're suggesting, if I understand, I see clarification, you're suggesting to get into that market in terms of equipment to manage medical surgical supply in hospitals, right?
Yes, that's correct.
And you're suggesting we work with JD Medi to do that?
That would be the ideal scenario. So
How long do you think that would take?
not as long, roughly about 6 months if you initialize with JD Medi now and start the development of this product. It's extremely similar to the products you're currently offering, and it's not a new innovative development. There are already companies in the market that are producing these products, and as JD Medi has been in here 25 years, we doubt they're going to be slow to get on board. However, if there are issues, the fact that there are at least 3 suppliers that are currently making these products gives you a second option to go to if JD Medi doesn't work out.
Tell us more about the innovation proposition. I'm a little bit disappointed by the value creation. Could you tell us about that?
So the innovation, well, as a HAS division, within the IT division, we were limited a little bit in the scope of what we could do. So something like home-delivered pharmaceuticals or a complete M2M solution, while it would be fantastic for Canadian healthcare overall, it's just a little bit outside of our capital expenditure. So what we've done is we've looked at a real problem that exists today, but more importantly, a problem that we have actually the potential and the ability to solve. So while it does just start with these bracelets with the barcoding, and it might not sound so innovative, you have to consider the actual effect. So you're closing out the cycle now. Nurses go and get the drugs, and they know they're getting the correct drugs because they're using more machines. But there's now no room for error at the other end. They take these drugs, they have to scan, they get told it's the right patient, they get all of their details, and they're really ensuring there is value creation in that sense. In regards to the total value creation, it does contribute holistically to your entire product offering. So something which you told us you were extremely excited about was your Relay Health, storing all health records in Canada, but that has had disappointingly low uptake. This will integrate with Relay Health, but it isn't a big capital outlay for hospitals. So it allows you to slowly creep onwards and onwards, developing more and more of a base for it, until when a hospital does finally decide to switch over to Relay Health, they already have a range of software and a range of products which is ready to integrate immediately.
Can I add to that? It is not exactly a huge capital expenditure for us. It is essentially a value add to the current products you're offering. So these are printers that will be distributed to the hospitals, and they'll print the armbands themselves. So these armbands aren't to address profitability issues, but more the macro factors that are affecting the healthcare industry in Canada, and your key strategic objectives of reducing costs, increasing efficiencies, and saving lives.
You know, I hear hospitals, even hospitals as we mentioned, the big growth industry now is kind of old age homes and the aging population and so on. You know, based on our current competencies, are there other hospital type environments where we could take existing core businesses and expand and put them into other sectors?
There definitely is, but what we were looking at for this solution, you asked us what to do with HAS, which is your hospital automated solution. So while the technology might be transferable in the future, for us the focus was really how do we help hospitals. In the future, we're looking more at probably your pharmaceutical side, would be able to distribute those into the long-term healthcare segment, but that we thought didn't really tie into what we were trying to do in the HAS sector.
Sorry, your presentation pretty much touches on how everything goes well. So what happens if one of these opportunities does not exist? Have you guys looked at a contingency plan, and can you elaborate a little bit on?
Yes, certainly. So there's probably 2 aspects to that. Firstly, in terms of the everything goes well, we have actually done both a risk mitigation strategy, which is up on the slide now, but perhaps more relevantly, within our financial analysis, we've looked at a worst case scenario, and we mean that in every aspect. We've looked at a low uptake rate, we've looked at hospitals not being interested, and we've looked at struggling with sales. Now, we don't anticipate any of these things to occur, but even in the scenario that they do, we've run over 1,000 simulations to determine that the strategy, no matter what really happens, will have this secure and profitable avenue. Now, are you asking more in terms of this financial aspect, or in terms of a more general?
A little bit of both.
So, do you want to go through some of it?
Yeah, so looking at, say, the RFP NPV analysis as an example, we took, say, the lowest possible package that a hospital could buy. This is a micro hospital with 1 person or even a clinic, and the maximum package based on our case study of $3 million, so a suite of their products. we conducted a Monte Carlo analysis. So these are 1,000 individual simulations. And if you can imagine drawing a line vertically within the middle, that's our base case scenario NPV. So each of these strategies have a positive return, especially the RFP and the surgical and medical supplies. But if we don't gain market entry into these areas, the RFP strategy is what currently HAS stands for, and continue with the value proposition it can show to the current client hospital marketplace.
So if there's one of the three that we really say, let's go Monday morning, we're starting this, which one is it and what are we doing? What are the first few steps we're taking?
The first one would be the RFP, because that's where we already are. All we're doing is increasing our market share in our current market. This is our primary revenue source, and it is very volatile. Monday morning, we can start. We gave you a brief market segment. We just need to go back to that, and we say, this is where we're starting. This hospital, they're outdated, they're on outdated solutions. In the past year, they've had a very high percentage of adverse outcomes, and they're consistently being ranked low. This is our target. They have an opportunity for HAS to come in to help their systems, to make them more efficient, to refocus them to patient care, to improve their efficiencies, to reduce their costs. We already know how to do that. We're doing it. We just need to be actively seeking out, stimulating demand for our products rather than taking a reactive approach to wait for the demand through these RFPs. We can start that Monday morning.
Additionally, part of what makes this so lucrative is the fact that you don't have to pick between them and that they don't overlap. So for example, your sales and your lobbying teams can start working on the growing. That's going to be a different group of people than to those that need to start contacting JV Medi. And finally, the low capital expenditure and the nature of the armbands means that you literally can start all of them on Monday morning. You're not going to have to hire a huge new group of people. You just need to go into your current team, and these are all things which can be implemented immediately and at a low capital outlay originally.
Can you elaborate further, not on the sensitivity analysis, but the actual, how did you come up with the EBIT for, let's say, medical surgical?
Yeah, sure. So looking at the EBIT, we used your current EBIT and revenues from the RFP and basically use that as a guide to cost our cost of goods sold and the SG&A for the new products. So using a proportion of your revenues based on the EBIT you gave us in the case to scale and use that as a guide for the new products. So there are different price range, but essentially the proportions you get on revenues on top of the cost is the same.
Why do you believe that's
It's
the equipment for drugs and the margin and the cost of goods, et cetera, and the for medical surgery? Why do you believe that's?
So in regards to cost, we've actually taken a look at the pricing of your competitors' products in the pharmaceutical area. Then we've taken a look at the price of their products within the medical and surgical area. So if there's a premium on your products in pharmaceutical over your competitors, then we can assume that you'll have a similar premium over your competitors when it comes to medical and surgical. Within the actual area of will it be a similar cost, obviously the consumables themselves, whether they be the containers the drugs come in or things along those lines, are going to be slightly different. But one thing we were able to notice was that the actual design of the machines are very, very close. It's still locked cabinets which you need the barcode to get into, still distributing a similar product. And overall, we have gone into quite a bit of detail identifying the costs of your current products, your competitors' current products, your competitors' cost of surgical and medical products, and then a bit of analysis on identifying a reasonable target for what your products would sell for and cost you to make.
You need that be done with the same supplier.
That would be our ideal goal, yes. You have a strong... Yes, you have an extremely strong relationship with JV Medi, and that's something we're really hoping you can carry through. It's a great relationship because they have been so reciprocal to your request for development and innovation. As the main product they're selling to you, you have quite a bit of influence in their development and what kind of products they are producing. So you can leverage this 25-year relationship to ensure that you do maintain this constant contact with JV Medi and the way it's operating. Thank you very much.
Thank you.